We want to talk about the risk factors that may have contributed to the development of this cancer. There are modifiable and non-modifiable risk factors. The modifiable risk factors will start with obesity. So obesity increases the risk of dying from colon cancer. Also, it's interesting to note that there's a cumulative effect of obesity. So studies have shown that those individuals with obesity greater than 4 years have increased risk of colon cancer. Metabolic disorders such as type 2 diabetes are shown to have a 1.3-fold increased risk of colon cancer. Now, type 2 diabetes may be argued that it's modifiable versus non-modifiable. So for this situation, we're listing it as modifiable just because it can be associated with obesity, physical inactivity, etc., and those things are modifiable. So there's also evidence that when an individual has obesity and type 2 diabetes as well as physical inactivity, there's a consistent increased risk for colon cancer because there's an effect that hyperinsulinemia has on cell growth and survival. So that's an important risk factor to note. Also diet, especially diets high in calories, fat, and red and processed meat, and then in combination, diets that are low in fiber are linked to the increased risk of colon cancer. This is related to xenobiotics, nitrates, and other preservatives that are shown to cause cell damage. And then finally, we have smoking. Smoking is a carcinogen which causes DNA and cell damage. And then there's also evidence that supports alcohol consumption as a risk for cancer.